We're really excited about our upcoming abstract that I'll be presenting, looking at patients who receive Venetoclax plus azacitidine versus azacitidine alone with complex cytogenetics or poor karyotype. And what we were looking for was to see how much of the traditional bad outcomes we see with patients with poor cytogenetic risk profiles are from p53, which is closely associated with those poor cytogenetic risk profiles, or from the poor cytogenetic risk profiles in and of themselves, because no one's really looked at that in the era of these novel therapies like Venetoclax. What we found is really interesting. We found that patients with poor cytogenetic risk factors independently, that doesn't cause worse outcomes than you would expect with Venetoclax-based regimens, but the p53 mutations, which are highly associated with the complex karyotypes, those do cause worse outcomes. So I think what this is helping us do is further delineate the risk factors for patients who have good and not so good responses to Venetoclax, and we're finding that those risk factors are different than the traditional risk factors, which were defined in the context of, conventional chemotherapy. So really exciting, and I think as a practitioner, less concern about a patient's poor outcome if a patient just has a poor cytogenetic risk profile and if they are wild type for the p53. p53 positive patients, we still don't do well with any regimen. This is an area of the field we really need to work on.